In this video, I'm going to reveal a dirty little secret that most sleep doctors won't tell you before offering CPAP. Hi, I'm Dr. Stephen Park, board certified in both ENT and sleep medicine, blogger, speaker, podcaster, and author of the Amazon bestselling book, Sleep Interrupted. But before I get into what the secret is, I just wanted to ask you to support my channel by clicking the thumbs up button below, as well as to subscribe to this channel. This will help me to get my message of the importance of breathing and sleep out to as many people as possible. Also, I want to emphasize that this video is for educational and informational purposes only, and you should talk with your doctor before making any changes to your healthcare regimen. There's no doubt that CPAP has transformed countless numbers of sleep apnea patients' lives for the better. We also know that a large number of people just can't use it at all and must look for other options. So what's CPAP's dirty little secret? When I first read about this in a journal article many years ago, I was a bit surprised. But now that I look back on it in retrospect, I do remember seeing it happening to many people who are doing well on CPAP. What's happening is that in some people who use CPAP, they gain weight. The one patient I remember that piqued my interest a while back was a middle-aged overweight man who I saw over 10 years ago, who was sleeping much better on his new CPAP machine for severe sleep apnea. He came back regularly every year, sleeping well on CPAP, with perfect compliance numbers. I didn't notice anything until a few years later when I noticed that he was about 30 pounds heavier than when I first saw him. This was unexpected since good sleep is supposed to lower your weight. Around 2013, I came across an article in the Journal of Clinical Sleep Medicine, which was a prospective randomized study of over 1,000 people. This study showed that those who were fully compliant on CPAP gained about 3/4 of a pound over 6 months, whereas in the sham CPAP group, they lost about 1.5 pounds. In general, the more compliant the CPAP use, the more the weight gain. When I wrote about this study on my blog, I received 81 responses with everyone describing their frustrations about gaining significant weight. The common theme was that their sleep doctors refused to believe that CPAP caused their weight gain. One 5'1" commenter gained over 70 pounds after starting CPAP. I'll put a link to that blog article below. A number of other studies have been published since with conflicting results. However, a meta-analysis in 2015 combining all the available studies found that CPAP use did cause weight gain. So what are some of the possible reasons that you may put on weight when using CPAP? The most common explanation I've seen from various experts is that if you have sleep apnea, you'll have a higher basal metabolic rate or BMR. This means that you normally burn more calories at baseline, and this is thought to be due to increased levels of physiologic stress that's present due to having sleep apnea. These authors speculate that once you start CPAP, your BMR goes down, and so as your total caloric intake remains the same, then you put on more weight. There are a lot of holes in this argument since, in theory, your need or desire for sugary, starchy foods should go down once you're sleeping better. Also, in general, the better you sleep, the easier it is to lose weight. There must be something else going on. Here are two more possible explanations. This has to do with my experience treating patients with UARS, or Upper Airway Resistance Syndrome, where you can have partial or short breathing pauses at night that don't lead to apneas or hypopneas that's needed to be detected for a sleep apnea diagnosis. So even without official sleep apnea, you can have lots of brainwave microarousals due to these more subtle breathing problems. Similarly, when starting CPAP, the bulk of the severe sleep apnea episodes are gone, but you can have persistent microarousals, or the CPAP itself can potentially aggravate microarousals on their own. Imagine if you're a light sleeper, it's likely that anything on your face or inside your mouth will cause you not to sleep well. Another possible explanation has to do with your gut. This idea was brought up by some of the commenters in my blog article. Many of these comments mentioned bloating and various digestive problems while using CPAP. Swallowing too much air is also a common problem. That's called aerophagia. But you can also swallow smaller amounts of air into your gut, which can still cause problems. Another consequence of swallowing air is its potential effect on the gut biome, which is turning out to be much more important to your health than previously thought. Recent research has found that the ratio of good and bad gut flora can predict how heavy you are. Your gut can also be thought of as an extension of your brain, along with being a first-line immune defense system. Altering any of these three major functions of the gut can in theory alter your metabolism and weight changes in many different ways. And lastly, to tie the last two concepts together, Increased microarousals by CPAP increases the stress response, and this leads to negative consequences in your gut, shutting down optimal blood flow, digestion, absorption, and protection that your gut provides. One study that goes against the air in the gut theory is that slight weight gain was also found in children undergoing tonsillectomy. They found a 12% greater weight gain after surgery than expected. For CPAP and after tonsillectomy, perhaps it's a combination of lowered BMR and continued poor eating habits that's contributing to weight gain in some people. I realize that this is not an easy topic to talk about since we don't know exactly why it happens and in whom it happens. Is it possible that the weight gain may be significant enough to partially offset any benefits of CPAP? I think that it's important enough for sleep doctors to consistently mention this possibility when prescribing CPAP, just like for any prescription medication or for surgery. Also, knowing this, you have to have a plan in place if you do gain an unexpected X amount of pounds. You may also need to start thinking about adjusting your diet as well to try to prevent you from gaining significant weight. Since sleep and weight are so strongly linked, this is a subject I'll be talking about in much more detail in future videos. So that's it for today's video. Please describe your experience below in the comments area when using CPAP and weight gain. Did you lose or gain any weight, and if so, how much? Again, please click the like button and subscribe to this channel. This is Dr. Park, wishing that you breathe better so that you can sleep better and thrive. Bye-bye.